Welcome to the inaugural session of the five-part PAHO Research Ethics webinar series for health workers in the Caribbean. I am Dr. Edwin Balastig, Human Resources Advisor of the Subregional Program Coordination for the Caribbean, based in the PAHO office in Barbados. Today, we are joined by hundreds of participants from across the Caribbean and beyond. We wish to thank you for your overwhelming interest in the topic and show of support to this noteworthy and timely initiative. As of this morning, we received a total of 499 registrants, and with a good number of them participating live on Zoom today. It is noted that governance for health research in the Caribbean has significantly improved, as evidenced by functional research ethic committees across the subregion. However, important gaps remain in specialized ethics training for health workers on the ethics of research with human participants and ethics review procedures. This therefore highlights the need for health researchers to undertake some capacity building on research ethics as one of the foundations of a research ethics system. Furthermore, strengthening these systems requires a transition from seeing research ethics as a matter of mere compliance to active ethical deliberation and increased capacity among practitioners, particularly among Caribbean countries. So the objectives for this webinar series, one is to strengthen research ethics capacities among stakeholders involved in conducting research with human participants, including members of research ethics committees, their institutions, and among researchers themselves, and to provide opportunities for practical training on research ethics concepts and principles in alignment with international ethical standards. Today, we are very fortunate to be joined by a highly esteemed panel of speakers. And to give the opening remarks for today's inaugural session, we have our new Chief of the Caribbean Subregional Program Coordination, my own Chief, Ms. Leah Marie Richards. Over to you, Leah.
Many thanks, Edwin, and good morning. It is my pleasure to welcome you all to the first in our series of webinars on research ethics for health workers in the Caribbean. This series has been developed in response to a recognized need to strengthen research ethics capacity across the region and to support the development of robust, sustainable research ethics systems. As you all know, Caribbean countries continue to advance in health research, but it is essential that our efforts are guided by strong ethical principles that protect research participants, uphold public trust, and ensure the integrity and credibility of research findings. While important progress has been made in establishing research ethics committees and research governance mechanisms throughout the region, gaps remain in specialized ethics training and in strengthening the practical application of ethical review processes. So this webinar series seeks to address these needs by providing accessible, practical, and interactive learning opportunities for researchers, ethics committee members, health workers, students, academics, and institutions engaged in health research. For this, I am grateful to my colleagues from the PAHO Regional Office, Dr. Carla Sáenz and Sara Carrecero, who will join you later in other webinars, but they have dedicated their time to share with us and to share with you all the knowledge and experience that they have in this area, a very important area and one where we realize that it is of great interest to you in the Caribbean. As Edwin mentioned, we have over 500 persons interested in various aspects of this area. And I think it is important for us to continue these discussions at the regional level. Today's inaugural session focuses on ethical governance of research, a foundational topic that reminds us that ethics is not simply about compliance with rules and regulations. Rather, it is about fostering a culture of responsibility, accountability, and ethical deliberation throughout the research process. And as technologies evolve and research methodologies become increasingly complex, strengthening ethical governance becomes even more critical to protecting the rights, dignity, and well-being of individuals and communities. So for this, I encourage all participants to take full advantage of this series by engaging actively in the discussions, asking questions, and sharing perspectives from your own professional experiences. But before I close, I would like to offer a special call to action to members of research ethics committees across the Caribbean. Your role extends far beyond protocol review. You are stewards of ethical research and guardians of the rights, dignity, and welfare of research participants. As ethical standards evolve and research becomes increasingly complex, continuous learning and collaboration are essential. So I encourage you to use this webinar series not only to enhance your own knowledge, but also to champion ethical deliberation within your institutions, for you to mentor emerging researchers and contribute to strengthening national and regional research ethics systems. The strength of our research ethics systems depends on your leadership, your commitment, and willingness to continue learning and sharing best practices across the region. So I thank you all for joining us today and for your commitment to advancing ethical health research in our region. Thanks again, Edwin. Over to you.
Thank you so very much, Ms. Leah Marie Richards, our Chief of the Caribbean Sub-Regional Program, for excellently framing not just the session for today, but really this webinar series and how important it is for the sub-region. We believe that this is a highly opportune moment for us to be launching this webinar series, and we do hope that you will benefit from the expertise that will be provided by our speakers over the next 5 sessions. And so for today, we are also honored to have a PAHO expert who has been responsible for the regional program on bioethics of the Pan American Health Organization for a long period of time now, supporting countries in the Americas primarily on research ethics and public health ethics. Ladies and gentlemen, I would like you to please welcome Dr. Carla Sáenz, who is an elected fellow of the Hastings Center since 2019. She serves on the board of the International Association of Bioethics and the steering committee of the Global Forum on Bioethics and Research. She is a native of Peru and holds a PhD in philosophy from the University of Texas at Austin, where my son also graduated from, Carla. And before joining PAHO, she was a postdoctoral fellow at the Department of Bioethics of the National Institutes of Health, or NIH, and in the faculty of the Philosophy Department at the University of North Carolina at Chapel Hill. So without any further ado, I'd like to hand over you to Dr. Carla Sáenz, our regional program advisor on the bioethics of the Pan American Health Organization. So over to you, Carla.
Dear Edwin, dear Leah, it's great to be with you in this webinar. We're really thrilled at the Regional Program on Bioethics that you're organizing this and that there's so much interest across the Caribbean on research ethics. As both of you said, there's immense progress, but there's a lot to do. And I'm happy to be presenting to you all on this topic. It's going to be me and my colleague, Sara Carracedo, also from the Regional Program on Bioethics. And well, without further ado, let's get this started. I'm going to share my slides. Please let me know if you see my slides well. If you just can give me the thumbs up.
Yes, we do.
Wonderful. Okay, so today, as the introduction for this topic, we're going to talk about the ethical governance of research. And I'm going to go again into something that has been mentioned already. But you may wonder, what does it matter? Why do we care about this? So we care about research governance because we care about research. And why do we care about research? Because research advances people's health and well-being. Research is what allows us to find cures to diseases, to know which interventions work for people's health and well-being. If we live the amount of years that we live now, if we have cures or medical tools to prevent certain diseases, is because we have done research. So every time one of us goes to a doctor, goes to or interacts with a public health system, is benefiting from research that happened beforehand. So we all benefit from research, and it is our duty to ensure that research is conducted ethically. We don't need to reinvent the wheel. There are international ethical and regulatory standards that we can adhere and we must adhere to. And research is conducted globally. Research efforts team up with other teams across the world. We build on knowledge that was developed in another country, in another region. So it's very important, if we want to have impact, that we follow the same international standards. I want to highlight something that you will hear throughout these sessions, that we at PAHO have a view of research systems. Research ethics committees, for example, play a crucial role, but it's never going to be possible if they work alone to ensure that research is conducted ethically. They need to work collectively with national authorities, with national regulatory authorities, with institutions, with researchers, with publishers. So we all together have different roles, different responsibilities, and we must cooperate because we are part of a research system. And this idea is very important to PAHO. If you go to the website of the Regional Program on Bioethics or visit PAHO's governing bodies website, you'll see our document from 2018 is our last governing bodies document on bioethics, when we reflect on our mandate to integrate ethics in health. And for research specifically, we highlight the duty to strengthen national research ethics systems. And we highlight that a systemic approach is necessary to ensure that research is always conducted ethically. So following on this mandate and this view, we at the Regional Program on Bioethics at PAHO developed a set of indicators to strengthen national research ethics system. This is work that was done in 2018 initially in 2018, has been guiding our technical cooperation since then. The first publication on this even precedes COVID. And I'm gonna go through these indicators because what we tried to do when we were developing them is to see what are the main objectives. If we think about a system that aims at ensuring adequate research ethics governance, what are the pieces of that system? What do we want to achieve? And then what can be the indicator that measures that achievement? So one objective is that we want to ensure that we adopt ethical standards for research with human participants in accordance with international ethical standards. So our indicator is like, well, what are the countries that have a legally binding instrument that governs health-related research with human participants and that requires, for example, ethics review by an independent committee? So another key objective is that every jurisdiction establishes effective mechanisms for the ethics oversight of research. And the indicator that we'll have for that is like the number of countries or territories with a national, I would say, or sub-regional body tasked with the oversight of research ethics committees. For example, assuming the task of accreditation of research ethics committees, but also helping them with training and ensuring compliance with what research ethics committees have to do. Another objective really relevant for our discussion today is that we must enhance ethics capacity among researchers and research ethics committee. So an indicator will be the number of countries that have policies that support research ethics training for investigators and research ethics committees. And as you can see already in the way we frame this, we don't want just this episodic event, which is essential, but we want a general commitment to train on ethics. And again, this is something on which what we'll reflect throughout today. We must, as another important objective, advance transparency and advance integrity in research. And indicators we have for each of these goals is checking that the countries require the prospective registration of clinical trials in accordance with WHO standards, and countries that have policies on responsible conduct of research. So another component of research ethics system that focuses specifically on our preparedness for emergencies. And this is work that was done before COVID-19, and I think the pandemic showed how essential it was. So the objective is to strengthen our capacity to do research ethically during emergencies. And we need countries to have established procedures to do ethics review quickly but rigorously during an emergency. We at PAHO have been working assessing the indicators since, and I must confess, we have not done a good job with all the countries and territories in the Caribbean. We've done this assessment with the larger countries in the region, the 22 countries that have over 1 million 1 million inhabitants. And we're still working on ensuring that this assessment is comprehensive. But you can see in additional to the regional evaluation that was published in 2022 at Lancet Global Health, we have an up-to-date regional evaluation. And why is this important? Because the Caribbean is strengthening their research capacities. And as we move forward, as we strengthen research capacities in the Caribbean, as we see the importance to commit to do more research and do it better, it's good to know what is it that we should work on to ensure that our research adheres to international standards, to ensure that we have an adequate ethical governance mechanism for research. And as I said, we don't need to reinvent the wheel. It's great to see other countries not just having achieved significant accomplishments, but also working on them. And that's what we try to capture in our dashboard, that their countries are doing important work to achieve the indicators. And it's not just about checking the boxes. It's about the indicators just capture important areas of progress, but it's about ensuring that the entire research in a country is done ethically, as we said at the beginning. And that QR code is for our portal of clinical trials of the Americas, where you can see this updated evaluation or assessment using the indicators, including the dashboard and many of the resources I'll mention today. Okay, so if we get into the specific component of research oversight, I think it's very important that we clarify something. And I used a Venn diagram here, but the way I think about this in my mind is more like as a lasagna. So we have different layers of oversight. And we have ethics oversight that is conducted by research ethics committees for all health-related research with human participants. An additional layer, in addition to the ethics oversight of research ethics committees do, we, according to international standards, we should have the regulatory oversight by the national regulatory agency, what corresponds to FDA in the US. And the regulatory agency does an additional review and authorization of those clinical trials that are with drugs and devices and that seek the authorization of new drugs and devices. So that's not even all the clinical trials, it's a small set of clinical trials that require an additional level of oversight. This is the same content with some additional information. So all health research involving humans requires ethics oversight. And that ethics oversight is conducted by research ethics committees, but as we'll discuss a little bit more later today and in other sessions, those research ethics committees do not operate in a vacuum, and the national authority should accredit them to review, so they can confirm that they review protocol according to the international ethical standards that are, CIOMS guidelines that are the most updated standard, that even more comprehensive than the recently reviewed Declaration of Helsinki. So in addition to that, there's the national regulatory authorities oversee the clinical trials that seek the registration of new drugs and devices, and they follow a different set of standards, regulatory standards that are those established by the International Conference of Harmonization that for example, like GCP, Good Clinical Practice. GCP is a regulatory standard that the National Regulatory Agency follows for this subset of clinical trials that seek the registration of new drugs and devices. GCP is not for every research involving humans. So I think it's very important to clarify this. And I want to highlight something else. If you think from the perspective of the national authority, the ethics oversight that the national authority does for ethics oversight is indirect. The national authority, the Ministry of Health, doesn't review protocols. It is the research ethics committees that have that protocol. The health authority is tasked with the accreditation of the research ethics committees, and those research ethics committees will review the protocols. There's no need for duplications. Duplication is not appropriate. So the research ethics committee, when reviewing protocols, connects with the investigator. The principal investigator is who submits a protocol for research ethics review. The situation is very different for the oversight conducted by the national regulatory agencies following GCP. The national regulatory agency doesn't delegate to anyone the review and the authorization, the approval of these protocols that they review. It's not just a protocol, it's an entire package. They do direct oversight. The national regulatory agencies reviews and authorize these clinical trials themselves. And for this job, the national regulatory agency interacts with the sponsor, not with the investigator. So it's very important to clarify these different roles, because this is the architecture of research governance in accordance with international standards. And why are we highlighting this at PAHO? And because we see some confusion in that we see that standards that are for clinical trials with drugs and devices, and specifically for the regulatory oversight of the national regulatory agencies, we see that sometimes they're applied to all clinical trials, including, for example, those that may study a drug that is in the market without seeking any new registration, any new authorization of that medication. They get up, sometimes people think that they apply to all biomedical research, or that they're standard for all research, health research involving humans. And that is not the case. GCP is for clinical trials with drugs and medical devices. Everything else gets governed by international ethical guidelines, CIOMS. So it's not, but again, it's not that if you have a clinical trial with drugs and devices to seek the new authorization of these drugs or devices, it's not that you bypass ethics approval. No, 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 you need 2 layers. So always keep in mind this lasagna model. And it is complicated. And if you look at a region, there are some countries that require ethics review only for clinical trials or only for biomedical research, or for a subset of all research involving humans. And that is an understandable problem, given that the evolution of these standards that was mentioned in the introduction and what it takes to implement them has led to confusions in the region. So we wanted to start this important webinar with this system view, with this ensuring that everybody has an understanding of the, as it were, architecture of research governance, and frame within that system the ethics review of research with human participants that research ethics committees do. And we want to highlight, again, and on pain and sounding repetitive, I want to say that ethics review of research with human participants must be required for all research with human participants, not for a subset, not for those studies or those trials that go to the approval of the National Regulatory Agency on top. And if you look at CIOMS and the title, so CIOMS is the Council of International Organizations of Medical Science, and with the support of WHO, they developed these international ethical guidelines for health-related research involving humans. Bajo is a co-publisher of the Spanish version. These guidelines are very detailed, very comprehensive, and they're out for all research with human participants. It's not true that we have ethical standards for biomedical research that are different from the ethical standards for epidemiological research, that are different from the ethical standards for research with registries. As long as a study involves research with human participants, as long as a study involves, as long as a project is a research project and involves people, then it must adhere to the ethical criteria described in CIOMS. And as I was said before, doing ethics review of research with human participants is not ensuring compliance. It's not just checking on 3 boxes. It requires an ethical deliberation by committees. But the work of committees, and again, we'll have other sessions to focus on this. This is just to give you the big picture. Doesn't end when research is approved. They also have to monitor ongoing research, because it's not that ethics approval is a blessing that lasts forever. Science changes, right? We learn about risk and benefits, and what was ethically acceptable in 2010 may not be ethically acceptable in 2020. So committees should monitor ongoing research too. And as I said earlier, committees need oversight. Committees should not be like they do not operate in the vacuum. The health authority has the duty to ensure that those committees are capable of doing the work. They have a great and a very important task, but they need oversight. Someone needs to check, hey, yeah, they're capable, they're in good position to do the job. And if they need help, they need to provide help. So we at PAHO, and I'll say more a little, I added there a little picture of our tool for the accreditation of research ethics committees. So this is part of what I said before, and to some extent goes back to our second indicator that I mentioned earlier. Kind of like loosely go through them. So I said the research ethics committees must be authorized to function in their corresponding jurisdiction, and be supported as needed. And we at PAHO developed this tool for the accreditation of research ethics committees. And as far as I know, there's no tool in other parts of the world that is available that is similar to this, to make it easier for health authorities to do the accreditation of research ethics committees and to assure that it's done in accordance with international ethical standards and international regulatory standards. And here's a QR code for so you can access our accreditation tool, although we'll have a session focused on that later. And we have two levels. I say that we want this done efficiently. And there's one thing that we propose here that again is one of those things that always discussed, but has never, as far as I know, been clearly explained as we did in this tool, is that it does make sense to have two levels of accreditation of research ethics committees. So I'm going to give an example that I often give because I think it's useful. You know, when you get your driver's license, you can get a driver's license to just drive a private car, like what I drive. And you can get a professional driver's license, because if you want to drive one of those 18-wheelers in the highway, you need a different driver's license. To apply for a driver's license, a professional driver's license to drive an 18-wheeler, I mean, you need to have first a basic driver's license. And then if you're going to be that type of driver, you need an additional accreditation, an additional driver's license. So it's the same for research ethics committees. Every research ethics committee need to have a basic accreditation. And those research ethics committees that review studies that go on new trials of that the review clinical trials with drugs and devices that will seek the authorization of the national regulatory agencies and are subject to additional rules, they need an additional level of accreditation, which we call complementary accreditation. And I don't need to go into this detail now because my colleague Sara Carracedo will explain this in great detail at a next webinar. But for those of you that are already curious and checking the site, that I want to just tell you that the tool includes, we try to work in a useful format. So it includes on the 3 columns, the criteria for the accreditation, then the second column with the questions to review the research ethics standard operating procedures or the documentation of the research ethics committees for each criterion. And we also added notes in response to frequently asked questions that we get as at PAHO often. And since we're talking about 2 levels of accreditation, we include in purple whatever questions, whatever components apply only to those committees that will be reviewing studies that will be reviewing clinical trials with drugs and devices that go to the regulatory agencies. So if that's not your case, and those are the minority of studies, you can really avoid ignore what's in purple. So we have also questions to guide the ethics analysis of research involving humans. And I want to say this because again, this is our introductory session. We'll go into this content in greater detail later. But I just want you to be to rest assured that we at PAHO have developed tools to make the work of research ethics committees easier. It's not easy, okay? We know that, and we'll talk about that in other sessions, and we'll help you as much as we can to do that work. And we think that CIOMS is a phenomenal tool because it does show you all the grays, the granularity of ethics analysis, and it shows you, hey, this is the general guidance, but sometimes there may be an exception because of this and that. So we don't try to replace SIOMs, but what we have a publication which is Questions to Guide the Ethics Analysis of Research Involving Humans, that is based on SIOMs and based on many other publications by Zeke Emanuel and others, and prior publications of PAHO, where we have questions to help committees kind of make sure they're not forgetting any of the basics when they have their deliberations. And we have questions for review and for monitoring, because monitoring often gets forgotten. So we thought we had to bring this more prominently to the attention of the region. And as said before, it's not a checklist. Committees don't do checklists. It's just a tool, it's a series of questions to guide the committee's deliberation, the committee's thinking. The committees have a great, an absolutely important job to do to ensure research is conducted ethically. But we want to highlight that they have a job that's different from the national regulatory agency's job. And we are aware that in the Caribbean, in Central America, and in jurisdictions where there's still like some challenges in terms of establishing research ethics governance structures, there may not be a national regulatory agency, or there may be a national regulatory agency that's not assuming this task. This is the trajectory of our entire region and the world. But it's important that we know where we need to go. And when a duty is not being done, when there's no national regulatory agency or no national regulatory agency that does what they should do in terms of regulatory oversight of clinical trials, what happens is that others start doing that job, okay? And I think we should all commit to ensuring that we establish the appropriate architecture for ethical research governance, where everybody has their job. Because guess what? I have a lot of experience doing ethics review. I have zero experience doing the work of the National Regulatory Agency. Those are different tasks, require different expertise. They're done differently. They interact with different entities. They follow different guidance. So I'm very aware there are sub-regional challenges, but that also means that there's great room for progress as the sub-regional research evolves. As the Caribbean does more research, is stronger at research, there's going to be more enhancement of this architecture and for ethical governance of research. I'm just going to say very briefly a couple of things about the other indicators. There's an indicator that has to do with transparency. And transparency is an important aspect of governance, ethical governance of research. In every country, in every jurisdiction, people should know what studies are taking place. Knowing what studies are duly approved to be conducted in a country is essential for trust. But also, repeating studies is an ethical problem. We're just duplicating risk for the same benefit that has been accrued already. So every jurisdiction should require that all clinical trials are registered in a registry that feeds into ICTRP, which is the International Clinical Trials Registry platform. And this is the WHO, these are WHO standards for clinical trial registration. And we have a nice infographics to explain that, because we understand it gets confusing sometimes. We're not going to deny the importance of research integrity. So to ensure scientific integrity, to ensure research integrity, in every jurisdiction, we need at a minimum some basic rules for responsible conduct of research, or what we call RCR, for fabrication, falsification, plagiarism. We need to say that what those are and what and why they're and that they're unacceptable. And I think we also need to adhere formally to the international criteria for authorship as captured by the International Council of Medical Journal Editors. Again, I'm emphasizing the importance of training for all involved parties, not only for research ethics of research with human participants, but also for responsible conduct of research. last but not least, we must prepare for future emergencies. That's an important aspect of our governance, ethical governance for research. We need we need to, ahead of an emergency, we need to have mechanisms to conduct ethics review quickly but rigorously in an emergency. We need mechanisms to avoid unnecessary repetition of ethics review processes. We need a strategy at a national level or sub-regional level that ensures that we don't have many committees reviewing the same study again and again and again, because that's not what we need in an emergency. I'm not sure that's what we need in any other circumstance anyway, but clearly that's not what we need in an emergency. And part of this preparation for future emergency inquires doing the work necessary to ensure the population trusts research and the research products. And we continue to experience challenges from lack of trust in research, for example, in the refusal to get vaccines. So this publication, Catalyzing Ethical Research in Emergencies, Ethics Guidance, Lessons Learned from the COVID-19 Pandemic and Pending Agenda, is PAHO's regional reflection on what we learned during COVID. You can access an entire web page on this guidance. We have a summary, like an executive summary. We have specific guidelines, guidance for committees, for national health authorities, and we even have slides on the content that you can download if you want to share more specifics of this with your members of your committee on your institution. So I'm gonna end here, and I'm just gonna leave you with the website of the regional program on bioethics and the listserv. And well, these are some of the tools that we have, but I'm gonna just pass the baton to Edwin for questions. I'm gonna leave this for a second in the background while we talk.
Thank you so much, Dr. Carla Sáenz. We could feel your expertise on the topic, and we do appreciate it. We very, very much appreciate your sharing your knowledge and expertise on the topic. And so I think what you mentioned today, we really do like it and appreciate it very much, particularly the lasagna framework. So I really would like to thank you for laying the groundwork, for laying the foundation for health research, ethics governance in the Caribbean. That I think framing it very well is very, very important for us, particularly for this inaugural session. And also, I like the lasagna. The Caribbean loves food, and I know Peru does as well. And so it's very much part of our culture. And you're making us hungry, not just for more food. It's just almost 11 p.m., 10:49. However, it's making us hungry for more information, on health research ethics. And we really are looking forward already to the next sessions. But before we do that, we'd like to move to the Q&A session. So you will see on the chat the link to a Q&A session with there are three questions initially. And let me share my screen so that you could also appreciate this particular participatory platform that we have here. Okay, so are you seeing my screen right now? I'm not sure if you are. Please do.
Yes.
Okay, great. So please take out your phones and scan with your camera the QR code to join the survey. This is going to be a short survey of 3 questions. And for those who don't have their phones or their cameras ready, you could go to the chat. I've put in the link there. You could click on the link and participate in the survey. So there are just 3 brief questions. Which country are you participating from? Which part of the presentation did you find most useful? And do you have any questions to the presenter? And please type in your question below in the space that's going to be provided. You need to click submit to be able to participate and send in your responses. So we're giving you a couple of minutes to do that. Please do so. Again, take out your phones, scan the QR code that you will find on the left side of the screen. Or you could click on the link that I shared in the chat. And then please do respond very quickly. We don't have a lot of time. And then we would love to have your responses. And then it's going to show, once you submit, it's going to show on the screen. All right. So please do go ahead and do the interactive survey, please. All right, we're not seeing any responses submitted yet. So please do pull out your cameras. Pull out your phones, scan the QR code, and please start responding to the questions. In the meantime, we could also, while waiting for people to send their responses, we could also open for any questions. So I'm seeing Giselle coming, who has raised her hand. So, okay. Please, okay, let me, Giselle. So I have Giselle raising her hand, so I'm allowing her to talk. So I'm going to unmute you. Oh, okay. So please go ahead and unmute yourself. Okay, I think you have access to your mic now. So please do go ahead, Giselle, if you have any question. Yes, Giselle? All right, so while Giselle is probably trying to work on her camera, I have a question here on the chat. Which Caribbean states have human ethics research legislation? Does PAHO WHO have model legislation text to avail to states to inform fashioning legislation?
Sorry, can you repeat that,
Yes.
please?
Yes. Oh, so
Just distracted
Carla?
with the app myself.
Yes. So the question is, which Caribbean states have human ethics research legislation? Does PAHO/WHO have model legislation text to avail to states to inform fashioning legislation? Very interesting question.
Thank you. Thank you so much. As I said, we don't have in our evaluation every single country in the Caribbean. But I'm gonna go by memory. You can check yourselves in our dashboard. So Jamaica has a well, the term legislation doesn't really apply. Jamaica is the only country in the Americas, as far as we know, that has a national instrument that is not legally binding for research with human participants. Then it has an important done an important work, except that should be legally binding. So that's a challenge that's in Jamaica's agenda. PAHO has been working a lot with Trinidad and Tobago. This is something that started many years ago when Edwin was the advisor then. So we've done a lot of work in Trinidad and Tobago and developing a national policy for research ethics that establishes an ethical research governance it's my understanding that that policy was approved by the cabinet and is still in the process of getting the last layer of formal approval. As far as I remember, Guyana has legislation for research with human participants according with international standards, and PAHO does work very closely, as we did work with Trinidad and Tobago, not just giving them, hey, here's a template that you should follow, but making sure, but developing, drafting, revising these legal documents with each country. And my colleague Sara Carracedo and I think we counted that we did 23 of these documents in the last biennium. And it's not one size fits all, because there are many countries. We know what everybody needs, but they may have different institutions. You need to see what do they have first. So the way we work at PAHO is that we work with the country, say, hey, let's check this assessment. Let's see where you are, and then let's make sure we do whatever is needed so you get to achieve all the indicators. So in this it's not a work that is like one meeting. It's a lot of work, but because we work with a system approach, we, as part of this effort, always make sure we do training with all the research ethics committee, because it's not enough if the national authority comes up with a piece of legislation or it doesn't have to be a law. It can be a legally binding document by the national ministry, by the Ministry of Health, but it doesn't make it. We will not achieve the goal if it's just published and no one knows what to do with it. So we approach this with a system. We have a system approach, and we ensure that also in the interest of transparency, in the interest of everybody understanding what are the ethical standards, we make sure that there's simultaneous ethics training with all the relevant stakeholders. So is it okay if I respond to a question that is in the chat?
Sure. I'm seeing, is there a short course? Is this the one you're looking at?
Yes.
Is there a short course available in research ethics for which one can obtain a recognized certificate? Please do go ahead, Carla.
There are some that are online, and including one for there used to be a grade one, and then that preceded SIOMS. Then there's been an attempt to update one, and so there's one now. If you know, go to Global Health Trainers. There's one there. There are other courses offered, and that includes CIDI is a platform many of you may be familiar with, but that's something. I mean, institutions may connect with CIDI as a platform that offers research ethics training, so everybody in the institution gets accredited through or gets some training through CIDI. So the Global Health Training Network is a platform, a training platform that is housed by Oxford University and partners with WHO for many research ethics training initiatives. There used to be so many options out there that we at PAHO did not develop one or not one in English, but the question makes me think that perhaps we need to have one on our own. So everybody has something in their to-do list as a result of this session.
All right. Thank you very much, Carla, for those responses. And thanks for those questions. And so now we could go to the interactive platform, and you could see a lot of 136 responses already. First question was, which country are you participating from? And we could see Jamaica has 27% of the pie with 37 respondents. So shout out to Jamaica. And then Trinidad and Tobago with 24 respondents, accounting for 18%. And we also see Antigua and Barbuda, St. Kitts, Bahamas, St. Lucia, Turks and Caicos, St. Vincent the Grenadines, Iowa, USA. Wow. So Dominican Republic, St. Lucia, Turks and Caicos Islands, Cayman Islands, and Barbados. So we've got it all over the Caribbean, but even beyond. So we're even seeing USA, Dominican Republic, and particularly Iowa. So, and I think in the chat I saw somewhere there also outside of this the Caribbean region. So we really appreciate and thank you for your interest and for joining us today. So which part of the presentation did you find most useful? And so we're seeing here 11 respondents saying ethics committee, but also health research governance, importance of ethics, purpose of ethics, human participants, principles for research, overview of ethics, and the types of research. So I think a lot of them really learned from this session, and I'm glad that they could recall, meaning that they've been very attentively listening to your presentation, Carla. And so we do appreciate that, and thanks very much. So we move on now to some of the questions. Who is responsible for ethical governance and oversight of an NGO which gets support from Ministry of Health and other entities that provides treatment to clients and conducts research using the data from client visits? I am not aware of a research ethics committee as being part of the NGO I am referring to. So this is a very specific situation, Carla. I don't know if you want to respond to this, or would we need further
I can.
clarification?
So, and I'm gonna start with the bottom. It's not either CIOMS or the Declaration of Helsinki. CIOMS and the Declaration of Helsinki are entirely consistent. But if you think about this, CIOMS is, CIOMS is it's a little bit of a, where do you get it? Like here, like a little bit of a thick book, okay? A Declaration of Helsinki is a declaration. So it's not possible for any declaration, as fantastic as it is, to cover all the detailed guidance that you provide, that CIOMS provides. So CIOMS is richer in that way, that it's beyond the declaration. So, and second, the Declaration of Helsinki is issued by the World Medical Association. The World Medical Association has key role ensuring that medical research is conducted ethically. And they don't mean to claim that ethical standards are restricted to research that is not conducted by physicians. But they have that mandate. They talk about what their mandate is. So CIOMS, because of that, is broader and more detailed. But content-wise, there is no contradiction whatsoever. And so it's perhaps a version of the question is more specific. We were talking about ethical governance of research. So ethical governance of research entails the ethical governance of, is different from the ethical governance of an entity. So I'm going to talk, for example, about PAHO. The ethical governance of PAHO's research is in charge of PAHO's Research Ethics Committee. But that's different from the governance of PAHO as its own. So in this session, we've been talking about ethical governance of research, and all research conducted by an NGO or a Minister of Health or an academic entity or whatever must follow the same standards, regardless whether it's clinical trials or surveys or research with individually identifiable data or research with individually identifiable samples. As long as it's research with human participants, regardless of who conducts it, it must adhere to CIOMS standards that include the Declaration of Helsinki standards, and that entails the prior review of research ethics committees. So that should I don't know if it's gonna move.
Yeah, thank you very much, Carla, for those responses and for the clarification regarding SIOMS versus a Declaration of Helsinki, and also for providing guidance on the work that an NGO is doing in terms of health research. Thank you for that. But there are other questions that are here as well. What are some practical strategies healthcare organizations can use to ensure that ethical governance principles are consistently applied at the frontline level?
We have in this session focused on research ethics, but PAHO's mandate is to ensure that all work in health adheres to ethical standards. So, and that includes clinical work, that includes public health work. And so today we've talked only about research. There are different standards for clinical care, different standards for public health work. And it's very important that we don't put everything in one basket. And the challenges that one encounters when providing clinical care are very different than the ones one encounters when doing research with human participants or when doing research in general. And it's, well, perhaps it's another series, Edwin.
Yes, you're right. Okay, so well, somebody said that it was asked, and then someone said, please send me the link of all the courses. They want to take all of the courses on research ethics, Carla. So you've just generated a lot of interest.
Well, if you go to our website, or the website of Regional Program on Bioethics, we do have a link to some resources that are out there. And if you sign up to our ethical research network, you will receive all the information about new training opportunities. And some of those are not just regional, but also global.
Great. Thanks for that response. There's another question here. Are the research regulations the same for researchers in indigenous medicine among such people with different cultural responses?
It's all the same. Research ethics is, we have a body of ethics guidance for research, and research, as long as it's research with human participants, it doesn't matter if you're studying like in an indigenous medicine or a new drug. You must follow the same standards, the same ethical standards. And if you think about this, and of course, this is the first session, we'll have a more detailed session on some of this content. We're still asking about the same. We're still asking, hey, what are the risks? What are the benefits? How is this done? How are people treated? It doesn't really, the type of research is not necessarily what matters. We are trying to understand, does it have social value? If it's methodologically correct, are people selected fairly? And those questions apply to all sorts of research. I want to highlight that the SIOMS guidelines, that the current SIOMS guidelines from 2016 replaced two different SIOMS guidelines that are no longer valid. The 2002 SIOMS guidelines for biomedical research and the 2009 standards for epidemiological research. It didn't help to suggest that we have some ethics standards for this type of study, some ethics standards for this type of study. The research ethics standards of SIOMS apply to all research with human participants.
All right, thanks so much for that clarification. I think that's very useful to have a uniform standard across all types of health research, including that involve human participants. Thanks so much for that. There's another question here regarding the seminars, if these webinars could include legal or law specialists in ethics.
My colleague, Sara Carracedo, is a trained lawyer, but I must emphasize that ethics and law are not the same. Okay, the law among all our ethical duties, only a small subset of them is susceptible, is adequate to be captured in a legal instrument. And so it's very important that people that come to the discipline of ethics with a legal background have that understanding, and they don't reduce ethics and the richness of our ethical duties to that very, very small set of duties that can be captured in a legal instrument. Something as basic as informed consent, it's not a legal duty because there's so many, and if you go to SIOMS, and we will talk about it, there are circumstances in which it's ethical to get a waiver of consent. So the only legal duty would be to ensure that every single protocol gets prior ethics review by a committee, and that committee will not do a legal work. The committee will do ethics work, and that requires deliberation, ethics analysis. So yes, we do have a legal specialist that's a trained ethicist, but we will be focusing on the ethics.
Thank you so much once again for that very clear response to the question. And then here's another one. Okay, before we proceed, I'm looking at the time. It's 11:11. If people, I know we only have this for an hour, but we waited for some persons to join us. If people are willing to stay, we could continue. And I don't know, Carla, if you're okay as well for us to continue.
I'm okay.
I know there's a lot of questions, and we're glad for those questions because this really makes it very, very participatory. So if it's okay with everyone, we could continue and proceed with the next question. As AI becomes increasingly integrated into healthcare and public health research, what are the most important ethical considerations researchers should address to ensure that these technologies are transparent, equitable, culturally appropriate, and beneficial to the populations they are intended to serve?
Well, that's a tough cookie. And because I think of AI now the same way I think about computers. You can use computers, and we all use computers in so many different ways throughout the research process. You can use them, and same thing with AI in research. You can use them to plan your research protocol. You can use them to execute your research protocol. You can use some AI tools to help ethics review. And I really encourage you, if you're interested in the topic, to go to the portal, either the website of the Regional Program of Bioethics or a portal of clinical trials in the Americas. And if you go to the recordings of our previous seminars, you will see that we had, as far as I remember, it was in December last year, we had a session on AI and ethics review of research protocols with regional experts that are working on this. So you can use them to help disseminate results. There's so many different roles, and some of them we're still grasping today. One thing that we have to keep in mind is that AI is here to stay, and it's on us to ensure that that we use it in a productive way to serve the health and well-being of our populations. Just this morning, I read a report that MIT published on AI and education that was incredibly enlightening and also challenging in terms of how we have to start thinking about AI with a productive way and without thinking like, oh no, let's just forbid it, because that's not realistic and also to some extent irresponsible. We have tools to do our work better. Well, it's better use them. Let's learn how to use them ethically.
Yeah, thanks, Carla, for that response, because really, even the ethical regulation of AI is also
Work in
transitioning.
progress.
It's also evolving, right? And also, if you are to even submit an article for publication, most of the journals would ask how you use AI. You have to declare it, right? I think it's
Yes.
very important. When you're doing research, you also need to be cognizant of how you're using AI, and you need it to declare. In fact, most of the journals today actually require you as part of your submissions to declare how you used AI. Yeah. Mhm. Okay, so that's very interesting, and I really very you were going into the future already, and well, it is the present now when it comes to the use of AI. All right, so moving on, when is it a good time to seek accreditation for an ethics committee? Does a committee have to be in existence for a number of years?
Great question. To seek accreditation, there must be some entity willing to accredit you, right? And no such entity exists at an international level. So if we think about, jurisdictions where there is more of a trajectory with this, I'm just, for example, thinking about countries like Brazil, Chile, Argentina. Well, there's a requirement that all committees are accredited in order to function. You cannot function if you're not accredited. So, but of course, they started at some point. So the committee started before the accreditation. So, so for there to be an accreditation, it's not enough to have a committee seeking accreditation. You need an entity that is that provides the accreditation, and we are aware that that's a challenge in many jurisdictions in the Caribbean because there is no such system for accreditation. And I truly hope the Caribbean can team up and come up with sub-regional accreditation. With a sub-regional accreditation system, it would do so much work to advance research in the Caribbean, to team up. And same thing for national regulatory oversight, for the regulatory oversight of clinical trials. It takes some effort, and teaming up is the right thing to do. But there's one thing I can recommend to every committee right now, and I'm sure my colleague Sara Carracedo will emphasize that when she covers this topic in great detail at a future webinar. Every committee now can check our tool for accreditation. And you can check if you were to be accredited tomorrow, would you be ready? Would you meet all the criteria for accreditation? So it's never too early to start preparing for accreditation by on the basis of international standards.
All right. Yeah, so thank you very much, Carla, for that response. And so before we proceed with the next question, just to let you know that our colleague Silvina and also Sarah have been posting some materials in the chat that are actually also helpful in terms of responding to the questions that you may have. So there are materials on artificial intelligence, on bioethics seminar videos, and some of the guidance documents that PAHO would have shared and also would have developed and shared. And also there are some courses online, some online trainings, links to them that are available and have been shared in the chat. So please try to review the chat as well for those links, and you could click on them. Yeah. All right. So moving on, let's look at the other questions. How do you begin to develop a landscape of health research ethic governance in a country without it?
I think it's very important to bring the key stakeholders together and start with an assessment using our indicators. If we go to our publication on the indicators for strengthening research ethics systems, you can see at the end there is the possibility of downloading a Word document where you can see the indicators and you can just fill in the information of your country, or I mean, sometimes your jurisdiction. I'm thinking, for example, Argentina is a federal country where all the governance is established, is done at the provincial level. So I think that's the first step. And it's also key that research institutions are vocal about the importance of doing this. And we at PAHO are always working with ministers of health in highlighting the importance of this. And I don't think I ever get the message that they disagree or anyone disagrees. It's just like there's so many things to do, right? But I think COVID was a fantastic reminder of how research impacts directly on our health and well-being. And that's why many jurisdictions that were thinking, oh yeah, this is important, but not that important, are thinking now, oh no, this is urgent. We also need to do our own research. And at PAHO, we always insist on our vision that we want the region to be able to lead the studies that will impact on our health and well-being. And we learned during COVID that sometimes the studies that make an impact or that produce evidence quickly are those that aggregate data from different jurisdictions. So that means you need a multi-site study. So we learned that our region, as a rule, only participates in multi-site studies if a country of the north invites us to join. So why are we not leading those studies? And I didn't say anything today, but this is the first of many sessions. We have our clinical trial accelerator initiative. And one of our goals of that initiative is make sure that our region is capable of leading those trials that have an impact. So that's what we're working on at PAHO.
All right. Thanks very much, Carla, for that, for emphasizing the importance of leadership and also for advocacy, right? And promoting this landscape of health research ethic governance for those countries that don't have that kind of system in place. Let's shift to the persons who have raised their hands before we proceed with the questions in the platform. I'm seeing Deborah Paul. You have your hand up. I've asked you to unmute. You could unmute yourself if you want to speak. Yes, go ahead, Deborah. Oh, that is not a raised hand. Okay. All right. So if that's the case, no, we will proceed with the next question. For those who are still willing to stay, you're fine with staying. We do understand that we've gone over time already, but for those who want to stay, please do so. Next question. There exist different mechanisms to clinical trial approval. First, the ethical committee approbation and regulatory agency approval, or the second mechanism when this process occurs in parallel. Which mechanism is better in the context of regulation time and the rigor of the evaluation? Wow, very complex question, but over to you, Carla.
Of course. So traditionally, we have the ethical approval first, and then the approval of the National Regulatory Agency. National Regulatory Agency would require that ethics approval of the protocol has been obtained first as part of the submission. During COVID, we at PAHO highlighted that we should, in the interest of time, we should do in parallel those processes that were normally successive. And as I mentioned earlier, we learned during COVID so many things that were great in emergencies, but then we were like, oh my God, this is so great. Why are we going to do it only in an emergency? So as of now, at least 2 countries in our region, which are Argentina and Brazil, are conducting simultaneously the approval, the ethics approval, and the authorization of the National Regulatory Agency. but of course, you need both approvals in order to study a clinical trial with drugs and devices. And we at PAHO are working, this is a great regional effort. We're working on pre-approval of protocols. Because if you think about it, and if you've ever reviewed a protocol in an emergency, the first thing that comes to mind, the first thing that certainly comes to my mind is like, oh my God, why are we reviewing all this just now? Because there's so many components that you could have pre-reviewed before, and perhaps on an emergency, just focus on the emergency related pieces. So we are working on pre-approval processes. So instead of just taking this huge step during an emergency, we can take, I don't know, kind of like half a step before, and that will help also committees and national regulatory agencies be less rushed, more, I mean, everybody has all their duties at the same time, and more focused on the key issues. And of course, it will allow us to start studies earlier. And if my colleague Silvina or Sarah can share, we have a website on pre-approval of protocols. And this is still work we're doing with the national regulatory agencies, with committees that will be piloting this, with national health authorities that oversee committees, with a group of experts from all over the world. And we have, for example, a little video explaining this, because this is something that if we want a region to lead, we need to take action now. So a future emergency in a region finds us in a different situation. This is something that has not been done. It's not as, oh yeah, let's adapt something from another country, but it's something that we're confident we can lead as a region, because we have the tools for regional cooperation, the forum of all the regulators, we have the forum of the authorities, the national authorities that do the accreditation of research ethics committees, and we have the energy to do it, I guess.
All right. Thank you very much for that question and the response, Carla. Silvina has just shared a link to the clinical trial accelerator pre-approved clinical protocols, right? So you could find it in the chat for those who are interested in this topic. And yes, so moving on, is there a regional body that provides accreditation for, oh, I think this is asked earlier, but well, we could read it again. Is there a regional body that provides accreditation for the national or other research committees? Do we have data on how many Caribbean states are compliant?
We don't. And I think that it'd be fantastic if there be a mechanism, a body that would assume the task of sub-regional accreditation of committees for the Caribbean.
Great. What is a key ethical consideration for research conducted at the undergraduate university level that may be easily overlooked or not considered? And this coming from Marisa.
It's the same. It's exactly the same. So as long as it's research with human participants, it needs to adhere to exactly the same standards of SEOMS. So we will, and that includes undergraduate research. And that perhaps shows that perhaps undergraduates should think twice before doing research with human participants if they do not know how to do it, or they don't have the guidance or mentorship of a more senior person to do that. But we don't have the ethics criteria for research conducted by senior people and the criteria for the ethics criteria for research conducted by junior people. And if we want those undergraduates to learn how to do research properly, we have to make sure that from the moment they're being trained, they know what the standards are and they learn to follow them.
Excellent response, Carla. Uniform standards for everyone, universal standards for everyone would apply, right? And so there's a question on the chat. Where can one access the PAHO ethics review application form? And well, I think Silvina or Sarah could actually share that in the chat. We do have the website for you to be able to submit.
No. I think there's no ethics review application for. We don't review
Oh,
PAHO
okay.
Research Ethics, I mean, I'm just trying to understand, perhaps I'm
Sure.
misunderstanding, but PAHO Research Ethics Committee does not only reviews research protocols conducted with PAHO's involvement, either
Yes.
technical or financial. So we don't we don't review applications, or we don't accredit committees either. But what my colleagues shared is the link to subscribe to our network, our research ethics network, and Silvina also shared, I think, the link to some research ethics courses that we have at PAHO site.
Okay, so thanks for the clarification. So the PAHO Research Ethics Committee would only review those that would involve research that's being conducted with the involvement of PAHO staff. Is that correct, Carla?
Of the organization.
Of the
If
organization,
PAHO
yeah.
is funding a study, or if PAHO is technically involved with the study, then those studies need to be reviewed by PAHO Research Ethics Committee, which is called PAHO ERC. That comes from PAHO Ethics Review
Okay.
Committee.
Great, thanks for that clarification. And so I think in response to your previous response to the question regarding research being conducted at undergraduate university level, I think Dave Cass is saying excellent, totally agree. And Paulette Cash is saying thank you for the clarification regarding the application question. Yep. Okay, moving on. There's still lots of questions. Does research ethics regulations be governed through the Ministries of Health?
Yeah, so normally what we need is a legally binding document. We need a requirement that research with human participants obtains prior ethics review that adheres to certain standards. It cannot be just voluntary. We should really require it. So in most jurisdictions, it suffice. I mean, the Ministry of Health has the legal competence to require things. So the Ministry of Health is perfectly competent to just require to issue a legal document that requires that research is conducted in a certain way. Is entirely within their purview. But some jurisdictions have opted for a legal body, like issued by the Congress, and that's possible too. It's not truly necessary, but it is possible. And so what we always advise health authorities, regardless of the imagine there's like this stair with all the hierarchy of the legal instruments, and well, one say like Constitution is the highest there, then there's their laws, and just you go for like you have a series of documents that are under the umbrella of a higher one. And what we always insist on is that if you have like a main governance document, be a law or a legal document of the Ministry of Health, if that's the highest document on research ethics governance, don't include every single detail. Don't include. I mean, you don't need to copy and paste SEOMs. You just can say establish formal adherence of the country to the ethical standards of SEOMs or Declaration of Helsinki. That suffices, because if these get reviewed, because they get reviewed, they get updated, then you're not. I mean, you want to ensure that you establish a mechanism that is rigorous but sufficiently flexible to stay up to date. So that's why we say just don't think about that highest legally binding document as your one and only piece. Some, I don't know, like the processes for the accreditation, they shouldn't be there. They should be in a document of a lower legal hierarchy. So if you need to update them, because we will learn something in 10 years, I'm sure. If you need to update them, then you can update them without having, say, to change the law or having to change the seminal, the umbrella legal piece.
Thank you very much, Carla, for that response. I'd like to add another layer to this question, right? Because I can recall when we were doing work in the legislation in Trinidad and Tobago, and also reviewing the health research ethics governance. I recall that there's also a layer, a level of autonomy that the research ethics committees should enjoy, right? Maybe you would want to, provide some guidance, additional
Oh, we will have an
information on
entire
that.
session on that. Don't worry.
Okay. Great.
Yes, we'll get there. We'll get there.
Okay,
There's
great.
a lot to
I
be
think I'm getting
said
too excited.
about how committees operate.
Mhm.
And yes, we'll get into the weeds later.
Okay, wonderful. So stay tuned, and we'd like to invite you to join the upcoming sessions for that question to be answered further. All right. Have international standards been developed to align with our regional context and participation in the global stage set for research by countries that are equipped and have strong financial findings for
Yes,
funding?
international guidelines. I mean, and I'm just thinking, not just this CIOMS guidelines from 2016, not only the Declaration of Helsinki from 2024, also the Declaration of Helsinki from 2013 involved a rich consultation and active participation for the region, from the region. As a matter of fact, we at PAHO, I mean, you Caribbean countries don't have that issue, but being able to participate, to give your contributions in Spanish is key. And many people that don't speak English, we want to make sure that it's not just for English speakers, it's not just for certain regions, that everybody's concerns and worries are addressed as part of these efforts. So yes, there are global efforts, and we at PAHO are very active. We take it upon ourselves to ensure that our region participates actively in these processes.
All right. Thanks, Carla. And more questions. I would like more information about research ethics when dealing with health-related issues that arise from Caribbean climate-related events.
Okay, so this is a session on research ethics. And we'll be focusing on ethics of research with human participants. When the research question has to do with Caribbean climate-related events and it's research with human participants, it follows the same standards. But we know climate-related events have to do with many issues that go beyond ethics of research with human participants. Mm-hmm. And those are issues that we'll not be covering. Some are issues for which we have done globally some important work. For example, if you think about gene drive studies, ethics of gene, like those mosquito studies, we call them gene drive because we're pushing for specific genetic mutation. We have some international documents on them, but overall, climate change impacts has an ethical dimension, clearly, and also impacts health research in many different ways. And some of those we're still like trying to grasp. So that I think would be the fair reflection.
Okay, thanks. I think a related question is, can the tools be applied to areas other than health?
When we talk, I mean, this guidance is guidance for ethics of research with humans, in the spirit of WHO's understanding of health as including all aspects of well-being. We see health as all-encompassing. So as long as it's research with human beings, and their well-being is at stake, and these are the standards that must be followed.
Okay, great. Thanks, Carla. How can healthcare organizations in the Caribbean balance ethical decision-making with the pressure to manage limited resources and maintain efficiency?
Well, this is a question about public health ethics and a question that has to do with a lot of the work that I do. But again, it is entirely, I mean, we'll need to to start with, we will need a couple of sessions, a couple of hours to get there. I strongly encourage you, if you're interested in that, to review, oops, I don't know when it just doesn't, oh, perhaps there. To review this document. I'm holding the Spanish version just because it's the one that I have handy. But it's how to make fair choices on the path to universal health coverage. That is a guidance specifically to make decisions about priority setting that in the context to make sure that those decisions are ethically justified, and not only in, I mean, we talk a lot about our limited resources, but truly everybody has limited resources. Health technologies are produced at a speed that no budget can match. So the countries that have done more work on ethical priority setting of health interventions are really the Nordic countries that have most the budget that surpasses all of us. And so that's again another topic, and we do have a course. Unfortunately, it's only in Spanish. A brand new public health ethics course. We've had a great success with our public health ethics training tools. We should seek into translating into English, but they have been I think for research ethics, for public health ethics training courses in Spanish, we have, I don't know, close to 30,000 registrations already.
Okay, great. Thanks, Carla, again. And that's another question. Who should be members of the Regulatory Oversight Committee of the NRA? What qualifications must they have?
The NRA, it's not a matter of committees. The NRA, the National Regulatory Agency, needs to have a team of clinical trial evaluators, and they need to be trained on GCP. And this is actually, we work very closely, PAHO's Regional Program Bioethics, we work very closely with our Department of Medicine and Technologies, and they are the ones that have the expertise on the National Regulatory Agency, and specifically within the National Regulatory Agency on how the evaluation of clinical trials must be conducted in adherence to GCP. Because again, it's a very detailed field with with highly regulated processes and procedures. And yes, we have a department that supports countries on that.
Thanks very much, Carla, for that. I hope that responds to your answers, that answers your question. So whoever sent that question, you could send us a thumbs up or type in the chat if it did answer your question, or if you want further clarification. Next question. Can PAHO give ethical approval for multi-country Caribbean studies?
PAHO, the approval that PAHO Research Ethics Committee provides is an approval. It's a second layer of approval. We don't aim at replacing local ethics approval. Local ethics approval is essential. It'd be short-sighted to think that we here at Washington would have the nuances to value and assess certain aspects of research protocols that will be conducted in Caribbean countries. So for us to even review a protocol, the protocol must have already obtained approval by a local committee in the Caribbean jurisdiction where it's going to be conducted. But we have often argued for the urgent need for the Caribbean to provide approval for multi-country studies instead of having so many approvals. Can you imagine a country conducted in all the Caribbean countries and territories? We need to have how many, you know the number better than me, Edwin, how many approvals by committees of each jurisdiction? And they're small jurisdictions, and there's a lot in common among Caribbean countries, and there should be a Caribbean level committee that is legally, formally recognized to provide approval to studies conducted in different islands. I think that would be very efficient and would also help the Caribbean stay up to date with the most updated standards for ethical research.
Right. Thanks once again for that question, Carla. Oh, there's a very
Yes, some have been already in the
okay, yeah. Relationship with the Global Health Network. I don't know if it's answered in the chat.
So there's a question about clinical trials,
Yes.
and again, it just goes beyond our the scope of this webinar. But I strongly encourage you to check our clinical trials, clinical trial accelerator site or portal for clinical trials. But and we're working now on a tool at PAHO that will be really useful to answer that question, to kind of like walk people through all the processes of conducting a clinical trial. And I think one thing that I would tell the person that wrote this question is to advocate for the establishment of a national regulatory authority that conducts the authorization of clinical trials, which, as I said, can well be done at a sub-regional level. And also keep in mind that clinical trials, the definition of clinical trial, I mean, a clinical trial is a study that prospectively assigns participants or groups of participants to different interventions. Those interventions are not necessarily new drugs. If I can do a study and I can do a clinical trial, and the intervention that I assign different groups to is, say, different informed consent formats. I want to see how I want to compare a video format of informed consent with a written format of informed consent, with a shorter version, say Q&A format of informed consent. I'm randomizing people to different interventions, and the interventions are consent processes, different consent processes. So keep in mind that that's also a clinical trial. Among the clinical trial, if a clinical trial is assigning people prospectively to an intervention that is a new drug or a new medical device that we're seeking to register, well, then that is a clinical trial with drug and device and needs to go through the National Regulatory Agency approval. But, we at PAHO did the hard-boiled egg, study. So communities, it was a cluster randomized trial where communities were, some communities were randomized to be given an egg with every day, to giving all the children an egg with every meal, or I think an egg in the morning. So an egg can be an intervention. You randomize people.
All right. So should the NRA be regional or by country? I think this is responded earlier, but I don't know.
Just an example, Europe has a regional agency, so I think the Caribbean can do.
Okay. Okay, so there's none. Can the presentation be shared? For sure, we will be sharing a recording of this session, and we will give you updates on how that could be shared in the subsequent sessions. How to strengthen governance in bioethics.
We've talked a lot about how to strengthen governance in research ethics, which is a subset of bioethics, and I would strongly encourage you to be clear that it's not one size fits all. One thing that I may want to highlight is that we have ethical guidelines for surveillance, and in guideline number 2, there's it's specified that please let's not mimic for surveillance what we do for research. It's different, and but the unquestionable piece is to to enhance training on ethics. Of course, on research ethics for the research piece, but an ethics of clinical ethics for healthcare delivery, public health ethics, for all the decisions about health that impact on population. And sometimes in the clinical setting, you're actually applying something that was decided as the how-to at a population level.
All right. Moving on. Well, the question has been asked already. Will PowerPoint be shared? Right. Is there this? Okay, so there's this question's also been answered. Course available for research ethics certificate. Are there any funding opportunities to improve bioethics in member countries?
I'm sure there are. We at PAHO are not a funding agent, but we provide technical cooperation. So with the goal of improving bioethics in member states. So send an email to Edwin and I will find a way to support.
Or if you have if you come across Carla, anything, I have their email addresses and I could easily share it to the network.
Yes, and in terms of opportunities, for example, for an ethics project, for funding bioethics, if we come across those, we send them through the regional research ethics list. So if you subscribe to the list, that's how we'll be able to help you.
All right. So we're going closer to, yeah, we've reached the end. And we have, it's 11:51 on my clock.
Double the time.
I do have other questions, but I won't do that anymore because I think we've really exhausted all of the questions. Let me stop sharing now. And yeah, so I'm just gonna read some of the things that were written in the chat. Okay. Thank you very much for this very informative lecture and all the answers to all the questions sent to the chat. Excellent presentation. Thank you very much to the PAHO team for a great start to these sessions. I look forward to the rest that is yet to come. Have a good day, everyone. Thank you for the presentation and answer the questions. Looking forward to the follow-up sessions. So we do have people subscribing already. That was supposed to be my follow-up questions, but they're saying already that they're attending. I wanted to get a sense as to how many and what are their key takeaways and all of that. But in the interest of time, I won't do that anymore because I think they really had a very productive session today, very informative. And okay, so yeah, that's it. I think
there's one quick question I want to stress out of a difference between biomedical research and clinical research. We do not need a typology of research from an ethics perspective. It does not matter because we have the same ethical guidance for every type of research. So of course, the risk of a study that is, I don't know, that involves a new drug is different risk of a study that involves a survey of health professionals, but we're always talking from an ethics perspective. We care about risk. So we do not have a different set of criteria, ethical criteria for biomedical research or for different types of research. It's for research with human participants. So you don't need to worry about that. We're good.
Thank you so much, Carla, for that. I think that's a wonderful way to end this session. Maybe we should have 2 hours next week rather than an hour because there's just so much interest in the topic. And so this is the one, to be honest, this is one underexplored area. And that's why the need, and that's why we're seeing so much interest and in this area, in this topic. And so we'd like to really thank you, Carla, for sharing your expertise. And we're looking forward to the next session, which is going to be in the next 2 weeks, right? Another Wednesday at 10 a.m. We're going to be having the next topic, which is, I need to be reminded what the next topic is, Carla.
Same here.
Yeah. If you have it, can anyone put in the chat the next topic, the presenter and the date? But I know for sure that that's in the next 2 weeks at 10 a.m. So we'd really like to once again invite you to our next session and to the succeeding sessions. And we do appreciate very much your participation, your active engagement, and for the questions. All right, so I'm seeing here now webinar 2. What requires ethics review for 9th of September with Carla once again
Okay,
providing this. Yep.
I'll do that. It's
Okay.
weird that it hasn't been asked, but probably because people were aware that that was coming in an entire new session. So
Right. And
grateful to
so
be with
we'd like to
you.
already ask you to prepare your questions so that we'll do it very smoothly, right? And so, Carla, you have the floor for your closing statements.
I just want to thank you, Edwin. Thanks, Leah. Thanks, Silvina and Sarah for making this possible. And thank you, all of you, for your active engagement. And we look forward to our continued conversation. And please visit our sites. You will find interesting tools of all sorts. Not everything is a thick book. But we hope these sessions really strengthen research ethics in the Caribbean. Thank you so much and have a beautiful day.
Okay, thank you very much, Carla. Thank you, Leah, for giving the opening remarks. Thanks to Sarah and Silvina and all our colleagues who have been very attentive, putting in, looking at the chat questions, responding to them, sharing all the materials. Thank you all very much. Thank you all the participants for your engagement. I'm still seeing 145 participants in the call, and we do hope that those who have registered, all 500 who have registered but have not been able to attend today's session, would be able to attend the succeeding ones. And for sure, we'll be posting the recordings and sharing these recordings. So please stay tuned to the next sessions, and you could revisit the session for today for those who have missed it. All right. Thank you very much, and have a good day, everyone. Bye-bye. See you September 9th.